changing the way people are using drugs in our region.
That's what the data is bearing out, yes.
And that was Teresa Vizina, Burlington's special assistant on the Overdose Prevention Center, telling our Ike Bain David earlier this year that the type of drugs people are using in our region is changing.
So what are those drugs and what does that mean in the state's battle in the drug crisis? Ike is here in the studio. What are you learning now?
We told you that the planned Overdose Prevention Center for Burlington will allow people to legally inject and smoke their drugs, a change from a safe injection site only. I found out the state believes it's entering a new wave of the drug crisis.
For years, publicly discarded needles have littered streets, a reflection of the drug crisis in our state. But Health Department Deputy Commissioner Kelly Doherty tells me they are closely watching a shift in drug use.
We are seeing more smoking of drugs rather than injection. So that is definitely on the rise.
According to the state, from 2019 to 2023, people who fatally overdosed from injecting drugs decreased by 10 percentage points. At the same time, the number of people who overdose by smoking drugs more than tripled. And what they're smoking is changing too.
Historically, there have been cyclical, you'll see a rise in opioid use, it used to be heroin, now it's fentanyl. And then you'll see it followed by a wave of stimulant use. So this is not entirely unexpected.
The state admits the drug use pendulum is swinging back to stimulant use. We saw that in the 80s and 90s, and with stimulant use, behaviors change.
So stimulants tend to speed people up, and you're going to probably see a bit more of agitation and a bit more activity from that person, versus opioids tend to slow your system down, and that's when you see the nodding off and the people leaving. So it's a very different presentation.
We discovered other evidence that drug choices are changing. The Howard Center's Safe Recovery Center gives out needles and pipes.
And they say the number of needles that they're distributing is down.
Yeah, dispenses are less.
And the number of pipes they give out is going up.
In January of 2024, the Howard Center distributed an estimated 866 pipes and 97,364 needles. In January of 2025, those numbers were 1,179 pipes and 66,330 needles. In August of 2025, the Howard Center gave out an estimated 1,140 pipes and 52,115 needles. Oftentimes, pipes are used over and over again, while needles are used once.
We're hearing more about crack, and people are needing treatment for that.
Drug use trends typically follow bigger cities, and right now, Montreal is seeing more people smoking drugs too.
There's definitely a rise in drug use by inhalation.
Cactus is a supervised consumption site in Montreal. Its director of community services, Alex Berthelo, says for the first time in 36 years, the number of needles they handed out dropped. A small decline, but it was the first time ever. While at the same time, the number of pipes they handed out skyrocketed.
But it was down for the first time ever. And something like 150 to 200% increase in inhalation materials.
Back home here, the spike in stimulant use worries people on the front lines of the drug crisis.
Somebody who's primarily using stimulants will present very differently than someone who's using opioids.
And does Narcan work on that?
No.
Yeah.
No. Narcan only works on opioids. So
we could be seeing a new crisis coming.
Yes.
How are you prepared for that?
So like I said, we have trained providers across the state with contingency management treatment because there is no medication for stimulant use disorder. And so that's one of the big things that we've done. And I think that there is work being done in the public safety arena around sort of the trafficking issues.
It's important to note that injecting drugs is still popular, but some drug users tell me they're shying away from injecting drugs for several reasons, mostly overdosing. They worry about what's in their drug supply, which could contain potent and deadly xylazine or fentanyl. They also say stimulants like crack and meth are more readily available these days. Darren?
So, Ike, what are police telling you about this substance switch?
They say it's too early to tell what this could bring, but we learned just this week about alleged crack dealing in Burlington City Hall Park, where the suspect admitted to investigators he bought and sold crack until he was busted by an informant who made several purchases before the arrest. Darren?
Channel 3's Ike Ben David, thank you.